There is so much information around health and well-being on the internet today. People often don't know where to look, who to believe, what to read, what to do. I'm Dr. Veena, a full-time NHS GP working in London, and I'm here to give you some tips on how to navigate the rise of social media experts. I would first and foremost like to say that no one should be giving personalized medical advice on the internet. It isn't clinically safe to do so, because to give generic advice is one thing. To give personalized advice as a clinician and physician, you need to have the medical past history of the patient. You need to know what medications they're on, their drug history. You need to examine them. You cannot just give advice, and it isn't something that our license supports, our insurance supports, and it's just not safe. So even though there might be health clinicians giving general advice on the internet, remember, they're not your doctor, so you might want to always go back and check with your doctor of how that impacts or affects your life. The first thing you can do is, if someone's giving advice, check their qualifications. Are they qualified to give the advice they have? Do they have the required credentials? Are they a physician? Are they a practicing physician? Are they a nutritionist, a physiotherapist? Who are they? Where have they trained? And are they still practicing? Do they have experience in seeing patients? Have they published books or journals around that topic, which has been proved with evidence? That's how you should really decide if that information is actually correct. In the West, we practice evidence-based medicine, where we need randomized controlled trials to do studies to tell us if a specific medicine or a specific treatment is effective. Just saying things on the internet because it's worked for you is not necessarily evidence. It's just anecdotes. It's anecdotal advice. It's opinion. It's you just giving a view of your story, which is fine. The internet's a place for everyone to share their stories. But just keep that in mind when you're listening to some people, because it may not be specific to the health condition with the right training. Always check if the person has a hidden agenda. Are they trying to sell you something? Are they trying to get you to buy their course? Are they advertising for a bigger brand who's paid them a lump sum? These are important things, because even me personally, I have been approached by a couple of, companies or entities where a substantial amount was offered for me to promote a specific nutrient tablet, a nutrient drink, several different health devices. And I wasn't fully convinced with the evidence that was given or the data that was provided. And I clinically and morally just could not comply. So that's me, and that's my personal story. And I know a lot of different people, not just in the health area, lots of different avenues in social media get challenged by this. So just check, do they have a hidden agenda? Are they trying to get something out of this? Educate yourself. If you're watching a video about a topic, read up around it on the internet by trusted sources to see, is the information actually correct? Or is there a gap that wasn't really followed or wasn't really talked about? That would also help you come to a conclusion of if you can follow that advice and what you need to do. Social media is amazing. It's a great tool at empowering all of us with knowledge, information, connectivity, and socializing in this way, where you can have a community with shared experiences. It can really have lots of power if used correctly. So I would just encourage you to advocate for your own health in a very safe manner. And if you're getting health advice online, always verifying the source, their details and credentials, if they're still practicing, and doing your own research. I hope this helps. If you have any other questions, feel free to leave them down below, and I'll do my best to answer them. I have personally had stories where patients have gone and done things that they have later regretted. I had once seen a patient who had come in with a severe pelvic infection because she watched a TikTok video where she was told to apply coconut oil on her cervix to prevent cervical cancer. She had been using a long spatula end of a spoon to apply coconut oil, in her nether regions. And this had caused irritation. There was a small tear, there was bleeding, there was infection. By the time she saw me, she'd been doing this for over 6 months. So she hadn't checked with anybody else. She hadn't consulted her doctor. It wasn't safe. That was one example. There are plenty of others where I've had to sit with the patient and they've shown me what they've watched and what they've gone and done afterwards. And each of our bodies are unique. Our DNA, the way we react to things, respond to things, from medication to environment to scenarios, is very, very unique. Just because something worked for someone or somebody has knowledge from, generations in their family where they've tried something, doesn't necessarily mean that is a safe thing for you to do. So if you're unsure, always go and discuss it with your doctor so that you can come to a collaborative decision of if that is safe for you to do. Another example was someone who'd watched a specific video of an influencer where they were using sunbeds regularly to get that glow. We all know the harms of sunbeds and UV AVB radiation that can cause and lead to precancerous changes and skin cancer. And I see this weekly in clinic. It's not safe. You should not be advocating for this on any platform. And this is another example of somewhere where media has influenced actual lifestyle change.